Oh,
Hi, everyone. This is Rodney Blackburn with Holistic Health Practitioners, whether you're in Cincinnati or Dayton, Northern Kentucky, and soon to be in Indianapolis next year. We have Susan Gibson, one of our most wonderful practitioners, been with me from the beginning, one of our admin liaisons. Kimberly Simmons couldn't make it today. And we are going to be talking to our wellness liaisons, these ladies to this way and down there. It's a little Brady Bunch thing going on here. We have all inspiring Jenny with the Spirit Ranch Wellness, also a practitioner in our community. You can find these all on our website at www.holistichealthpractitioners.org. We have also Sarah Pagel, who used to battle. No, she didn't battle. She's worked a very interesting lifestyle within the prison system for a long period of time, but she's got an incredible medical background along with Jenny, and she is our other wellness liaison. We are going to get in today and getting to the discussion. We're going to start off with Susan, because Susan's going to explain how this works, especially if you're inviting new members into the community over in Facebook or over at maybe the website. We're going to get into all those pieces and what a wellness liaison is, okay? A little bit about their background, how they can help you, how this is going to be of value to of you, and what you get by going through the program. And if I miss anything, Susan, I'll let you take it from here.
Well, I think some of that I'm going to let Jenny and Sarah take care of.
Yes.
So I am an admin in the community. Kimberly is the main admin. Let's face it, she does the bulk of the work. But when she's not able to, when she's ill, when she has things going on and she needs someone to cover her work within the community, that's where I come in. So what we do when you invite someone into the group, we ask them to answer a few questions, because it gives us a little bit of an idea what you're dealing with, what you're looking for, why you're here within our group. And we really do want to address that. If when they are your friends that are trying to join, answer the question and say they would like to speak with a wellness liaison, then we like to then kick that over to Jenny and Sarah. Right now, they have been sending out messages over Messenger. Sometimes you have to look for that message. It's usually, if you're not friends with the person who is sending you a message on Messenger, it's going to show up at the top of your phone, onto the top of your screen with a red dot. So you're going to want to look for that. And essentially, we're here just to help you find some answers for the dis-ease that is going on in your life, the things that are stressing you, the things that are making you anxious or depressed, or whatever physical ailment that you're going through. And the reason that you want to talk to Jenny or Sarah as a wellness liaison is because they're going to be able to listen to all of what you have going on. We're getting just little bits and pieces when you're asking to join the group. But if you're wanting to have someone look at the completeness of what's happening in your life, and then make some suggestions of some practitioners, because there's a number of us within the group that are practitioners, how do you know who is going to be best for you to speak with to get the answers that you need? So from there, I'll send it over to Jenny.
hey, thanks, Susan and Rodney and Sarah. So when I get a message that says, this person just joined and they're really interested in Wellness Liaison, the first thing I do, of course, is welcome them to our group. But then we've got a page on the HHP practitioners that discusses everything that we do. So in a nutshell, wellness liaisons are kind of like matchmakers. I love that. Yeah, that correlation.
Oh, yeah.
We have gone through and either interviewed all of the practitioners or we've reviewed their page, and we feel like we know a lot of what this particular practitioner offers, the services, their particular personality, how their office works, and et cetera. So when you come to us with your particular health concerns, usually we may know almost immediately, oh, I know this practitioner, and that one that's going to be able to help you. But we like to take a little time, listen to everything that you're going to tell us, all your concerns, and then review those practitioners and send you a list, or get back on a call with you, so we can tell you which practitioner we feel like would really help you. Sarah, anything to add with that?
Yeah, thanks, guys. I'm excited to be able to contribute to the community in this way, to meet. I've had some really cool conversations with some people, and just getting to hear different people's stories and their experiences, and help them kind of figure out what their goals are, and also figure out kind of what they're looking for in a practitioner, and doing my best to connect them with practitioners that, that I know that we have in the group that could potentially help them move forward in their health goals. Yeah, so I'm really excited to be able to have some one-on-one connection with the people in the community. We have there's 10,000 plus people in the community. So that's pretty awesome. And so that means there's a lot of people that are watching and listening, and maybe have questions that they don't feel comfortable putting out into this bigger community. And so, Jenny and I are definitely here to meet you where you are, and help you figure out what your next steps are in your health journey. So yeah, I'm just excited to contribute to the conversation and to the community.
Thank you, Sarah. Now you're a health coach, is that correct? Can you tell us a little bit about you?
I'm a functional health practitioner. So I run functional labs, and then I also I run functional labs like the poop, the pee, the blood, and then I correlate those lab results with your experience. And I do that on a one-on-one basis. So when I make clinical correlations, and then I create an individualized plan for you based on what's happening in your space. So not what I think is happening in your space, but what the labs and what your experience are telling me are happening in your space. And so from there, that individualized plan focuses on nutrition, sleep, exercise for the purpose of healing, and strategic supplementation, and most importantly, stress reduction. So yes, there is elements of health coaching that are involved in that, but I am primarily a functional health practitioner. So a little bit different, but I do offer those coaching services. And you, lovely lady, are a cancer coach. I'd love to hear more about that.
Thank you, Sarah. Anti-cancer coach. I started off with board certification health coaching, and had cancer in my life personally, and with my husband as well, and just spent years in research trying to find holistic ways to heal from cancer and prevent recurrence, and then got formal training and that. So becoming a part of this community was so important for me, so I could also direct my clients to those experts like you, because I would like to know, what do those blood tests say? How can Susan, who's an energy worker, how can she help them with their mindset? And there's so many other practitioners that I know that would help so much any cancer patients. Mm-hmm. So this whole community has helped my practice as well, but just to see the number of people that we help on a daily basis with questions. And our job as wellness liaisons is to help a little bit deeper, find exactly, not an opinion, because in the community, there are a lot of opinions which we value, and especially those testimonials. But we'd like to get people to go right to the practitioner that's going to help them the most.
Awesome. I appreciate you all saying those things, because when this was created, it's really designed because it's what you asked for. So if you're the mom or the parent or somebody who's just frustrated, tired, I'm at wit's end, I can't look up another thing, you're at this point where you're just like praying, like, please God, help me. I gotta have an answer. Well, to me, it's a wellness liaison is a great place to start. because like you said, all you're going to do is fill out some information online, really simply, put as much as you can, because then they're going to review it. Okay. And these are the same questions that they asked that were important, that all of our members basically are like, hey, these are the important things that would help me to make the best decision. So we took all that information from you all, okay, put it into an electronic form that you would fill out. And then the Wellness Liaison is going to look at all that information and match you up based on the same questions were given to our practitioners, okay? Because we need to get that information from them so we know. So all that is just a matchup of information. Now, the caveat is you get to speak with these ladies here, okay, who, one, they have some empathy and understanding, because I guarantee you have all been through some very frustrating situations medically themselves, whether it's mental, emotional, spiritual, whatever that is. I mean, Susan, she's not a wellness liaison, but she is a practitioner that works with women mainly women a lot, who've gone through traumatic, very bad situations, abuse on the highest levels. And so you have to have somebody also, this is why we bring people in like Sarah and Jenny. And so we'll be bringing in others as we get busier. But here's some other things. It's really that simple. Sit down, you pay $25. You're going to be able to spend roughly about 20 to 30 minutes with them on the phone and ask them the questions that you still have. Or if a question comes up, that's where Jenny, they're listening to their intuition, their medical knowledge, or a combination of those things to reach into that dialogue to make certain that they're going to try to give you not their opinion, not their advice, not even their professional advice, because that's not what they're there to do at that moment, but they are going to tell you facts. They are going to leave it in your corner because they want you to take ownership. They're just trying to take all the resources and information available that you're looking for and trying to condense it down so they can just easily hand it to you a little bit faster and in a safer manner, because going out and doing Google searches, even going to our website, is very time consuming. Okay. If you want to go to the website and look up every practitioner and learn about each one of those, believe me, we're going to provide that. It just takes a while. And some people, went from a chronic to an acute situation, or they feel like they're in an acute situation. So with that being said, you get a savings membership. I wasn't going to set this up to where, hey, for 60 days, you get the biggest savings membership, which means to me, it felt like I should have to give this to you because you're going to see the practitioners anyhow. They're the ones giving the discount. So have a savings membership. So whoever you're going to see, mostly whoever you're going to see, is going to have some discount, possibly even a free service, whether it's 20, 30 minutes over the phone or whatever you're looking for. At least you're going to save some money. Okay. And if that doesn't help, we got insurance people that are coming in to try to help you guys to save. And I'm not going to get down that rabbit hole, but these wellness liaisons, like I said, it's really just the simplicity of talking to them, opening up, having a fresh dialogue. It doesn't, if you're scared, that's good. You should be scared, because some people have to go through that. I've had to go through that to wake me up a little bit. And sometimes having that fear, but at a point, and Susan will tell you this because she's taught me quite a bit, is that you have to listen to your instincts, your intuition, your God self, whatever you want to call it, that gut feeling. And I'm telling you that speaking with these wellness liaisons, listen to your own intuition. If you think that this is worth it, then go and do it. But we have it all set up for you. And maybe it's not for you right now. Maybe it's down the road. Okay. But we're going to have them available. So does anybody want to say anything else that I've missed? Because I've done my best here to try to show the highlights and the value of what people are getting.
One thing I just wanted to add is the difference between going with the wellness liaison is like doing a Google search as compared to doing a scholarly Google search. You've got an expert that's going to be able to give you information, and it's not just an opinion.
Gotcha. Yeah, very true. Susan?
Yes, sir.
Any last words you'd like to chime in about? Anything that we've missed?
I can't think of any. Just welcome. We're glad that you're here. Reach out for help. You know, I think many people try to do it all themselves. I think a lot of people are out there trying to just hold it all together, and take a chance. Have a talk with someone who can direct you in the right direction.
Thank you. Sarah?
No, I'm just excited to be here and to help people in the community and connect people. And connection and collaboration are two things that are really important to me, and two values that I try and walk out every day. So yeah, just looking forward to connecting with people and helping people move forward in their health journey.
So go to the website. Just go there, at least go to the website, check out the page. There's a page there for Wellness Liaison. Just go up to the top and you'll see it. Click on there, get a little bit more information. And, you know, like I said, just listen to your intuition, and on anything that you do with us. You have free will on all of this. Nobody's trying to do anything except to try to help in any way, fashion that we can. That's what HHP was designed for. It's just a resource, whether it's a Wellness Liaisons, whether it's a chat room, whether it's directories, whatever it is, we're just going to keep providing those resources. So listen to your intuition, go over to the website, holistichealthpractitioners.org. And if you got any questions about anything, you can just go to our contact page, send us an email, and we'll get back with you promptly. And if worst case scenario, you can try our business phone at 513-805-2344. So with that being said, thank you guys. Thank you, ladies. I appreciate it. So hopefully they've learned a little bit more about Wellness Liaisons, and maybe we'll have you guys chime into the group every once in a while and, you know, chit chat with some people if you have time, but I know you're pretty busy. So thank you all. Have a great day.